Hi, this is a nursing professor here. I want to talk to you today about some traits that nurses should not have. We know that all over the news we've been seeing nurses doing terrible things. I mean, they've even been arrested for certain of these actions, and so I want to make sure that this is something we're not even on our radar because they are totally unacceptable. So number one is any type of unethical behavior, and you know what that might mean. I saw a video the other day, and I'm just going to give a little bit of credence to it. Somebody was, on a patient, acting like they were at home, with a patient. That was so unethical, so just poor taste, crass, poor taste for anybody in nursing to do. And I don't know whether or not she was a licensed nurse or a nursing assistant, whatever, but whatever her role was, she was definitely a caregiver in some facility. Also treating your patient as though you're talking to your friend. No, they are your patient. They should be given the utmost respect and professionalism, even when they try to take you out of it. And that's where it gets a little bit challenging. Overstepping your practice. We know that we are governed underneath the Nurse Practice Act. So know that wherever state that you're in, what that Nurse Practice Act says that you're able to do. Because if you start doing things that are not under the Nurse Practice Act in one state because you're a traveler, because you did it in your home state, then sometimes you can get yourself in a lot of trouble. Poor communicator, we know what that is. You're just kind of being sharp and nasty to a patient. A poor team player. It is so important to be a team player. We think about today actually happen to be Sunday, might not be the day that you're viewing this video, but there are playoff games that are going on. And although there are certain team members that are highlighted, if you listen to their speech after the game, they're going to say that it was about the team. They're not going to take all the credit themselves. And so in nursing, we need to be very aware of that. It is a team sport. Overconfidence, yes, you can have years and years of experience, but don't let your overconfidence get you in trouble. Always consult with someone if there's a little bit of a question about anything. Using poor judgment. There's a professional life and there's your home life. Keep your home life at home and keep your professional life at the bedside. Being inconsiderate, the truth is this, is that when you think about it, if you are a patient and you're lying in the bed, just by definition of your position in bed, it appears that all of your care providers are at a higher place than you. You try laying down and have someone talk to you from just above you. So already it doesn't feel like you're on equal playing field. And so sometimes that just position can get you out of sorts. And so let your patients have their say so. If they say that something feels uncomfortable for them, let's go with what they actually say. Ignoring our patients, can't ignore them. If they call that call bell 5 times, then you need to respond 5 times, because you know what? If you don't, it can be considered neglect, because it might be one time that they really do need something. And ignoring self-care. This is of utmost importance, because if you start to care for self, then you're able to do all of those things. So don't ignore self-care. Get adequate sleep, exercise, proper food and nutrition, time off. You're given days to take time off. It's okay to have a sick day. It's okay to take off a day after you've lost a patient, because we grieve as well. So policy might say something different, but you know what it takes in order to take care of yourself. So I hope you consider those things. And if you like this video, subscribe and like down below, and I'll see you next video. Bye for now.